everyone, we are back here at the Monteiro Clinic, and today we're going to speak with the owner, Dr. Monteiro, and get to know what he has to share with us today. Let's go? Today we came to speak with Dr. Monteiro about stress and hemorrhoids. How are you, Dr. Monteiro?
I'm okay today, and thank you for coming.
That's good. So you are the founder of the Monteiro Clinic, right?
Yes.
How many doctors do you have working here in your team?
We are 6 GPs, or what you call normally family doctor. Mm-hmm. Then we got 2 consultant specialists, radiologists, okay, and the 2 technician radiologists who they do ultrasound from pregnant woman in the gyno investigation. And also we have a specialist gynecologist. Then we got 2 nutritionists, 2 psychologists. Mm-hmm. Mainly that's the team, medical team who works here.
That's great. And I can imagine that throughout your experience here, you have been meeting a lot of people who are under stress. Sometimes they think they know, sometimes we think we know what stress is, but clinically speaking, what is stress?
As you said, it's true. I think that's the important point to start by. We've been meeting a lot of people with stress. Mm-hmm. In fact, even in UK, stress, I mean mental health disease, which involve stress, anxiety, and depression, they may be equivalent in 1 every 5 consultation for GP does. I believe it's the same for us, roughly. So, says that every 5 patients one doctor see in the clinic here, 1 may come to see doctor because of stress, anxiety, or depression, or mental health. Wow. So it's such an important situation that really I was and them happy when they told me you choose to talk about stress.
Yeah, and doctor, what does stress do to a person? What is the effect?
Yes, as you said in the beginning of your question, that people sometimes they think they know what is stress, and probably they don't do much, or they don't look for help, they don't try to find help, and they sometimes they don't have idea of consequences what stress does. Answer your question. First thing, stress is living situation, I mean mental or emotional situation where people reach the point they cannot cope with it anymore. Okay. And you also have to remember that stress, it can be mean 2 things. It can be bad for else, but can be motivation also. Yes, and this is different from people to people. What causes stress, for example, for me, probably something causes motivation for you. You know? Suppose they ask me to come to work in a radio company or TV company, I will be, oh, stress, I cannot sleep. No, they take my sleep. For you, maybe, oh, good, my door open today, it starts. Yeah. So it's different things. It's relative is to do with all that. When people cannot cope with any situation, mental, emotional, even sometimes physically, so they start going under stress. What they do, stress affects all body system. Okay. We start psychologically. We know anxiety days cause people difficult to sleep, change your behavior, change your mood. Insomnia, people not sleeping. Neurologically, or in terms of system nervous, they affect people accuracy. What people do this thing, they perform their acts, represent or work or other things. Also, in terms of cardiovascular disease, a lot of people with high blood pressure, which is a serious medical condition, is caused by stress mainly. Okay. There are other causes, but stress is one of the important causes of this. Heart attack, anginas, as I said, all this situation, either they part of the cause are stress or they exacerbated by stress. Cardiovascular disease, people with gastritis, there is people, we know how to talk about all these things here. But for instance, take example, gastritis caused by, depend of the kind of nutrition, alcohol, smoking, stress.
So we can see that there is a long-term effect.
Yes,
as well,
yes,
right?
Long-term effect with serious consequences.
So as you were speaking about gastritis, Tell us more about it. So those who are listening to us, maybe they are facing one of these problems. They can see the symptoms, but they don't really know what it is. What is gastritis?
Gastritis means simply like this: inflammation of the internal part of the stomach. So gastric. So everything is itis, that means inflame it. And what causes it? That's the problem. Taking example like this, there is order several, but you choose a good pathology, good disease, which can be stress related. Gastritis is caused by alcohol, by smoke, by nutrition, several other things, mainly by stress. So that means when people are under stress for long term, as you said, for long period, they start producing more acid than normal people living relaxing and calm. Producing this acid for a long time due to stress. So this acid causes swelling of the stomach and it causes ulcer in the stomach. Gastritis is the first phase, then which get worse when it reach phase of ulcer.
As you spoke about ulcers, this was my next question, because there are people who are also facing stress and they are reaching this level. So what about the ulcers?
Yeah, ulcers in a stage very advanced, and it can have very detrimental bad effect in the patient, and it can lead to even to death, because ulcer can perforate. When it perforates, it bleed. If it bleed, it's an emergency. They need surgical treatment. Emergency treatment immediately. If not treated in a few hours or very few days, that can compromise their life. So they can lead to conduce to the death.
So you spoke about many complications of a person who has stress can face. What are the long-term effects of stress?
Living under stress with time and chronically cause mainly this kind of change in the nervous system and the endocrine system, hormonal system. Normally, we work, we relax, we produce our level of hormone accordance with our needs. Then we stay there. But people under stress, they start producing high level of certain hormone, which in some stage is needed. That's the nature how we made human being and even animal. In a stress situation, we produce some hormone to allow us to fight, resist, or to run. Okay? But this is for short period, because nobody can fight for all the days and the weeks fighting. So it's something 5-10 minutes finish or short period. When they produce this hormone related to stress for a long time, that's cause our body to change constantly in an abnormal way. And this abnormal way affects all our system. For nervous system, cardiovascular, respiratory. That's why you see people feel short of breath, difficult to breathe, go to emergency, they do all the tests, they don't find nothing, because this anxiety, stress causes this change hormonal, and this causes damage for long term in the human body.
Okay, so maybe you are there listening to us and you are wondering, because maybe they are already finding the symptoms in themselves. So what would be the advices you would give to those who are living a life under stress, or maybe they want to avoid this kind of life? What would be the advices you could give to them today?
I think really this is the most important thing, apart of being explaining what is stress, the causes of fear, the consequences of stress, is to help people deal with stress, to live a normal life, more happy life, to produce better and live well in the society. In fact, stress is not very easy to avoid. Some people can deal more. Supposing in London where we live, so even wake up in the morning to go work, start stress with transport, with the time management, all these things. The situation is to teach people, all of us, to learn how to deal with stress. I think start by work. Most of us we have to work, number one, yes. Start by work is no worry, don't just focus on hard working, producing a lot or make whatever you call it, what we're looking for, fortune, whatever, but it's quality of work. Choose the work which switch for us, to allow us to give us life quality. We can continue our life in normal mood. So this one more important. And also, extremely important, maintain an insight of each one of itself. So when I mean maintain an insight to good awareness, consciousness of our thoughts, our emotion, our feeling, because with the speed of life, like take example like London, it's easy we lose control of all this kind of thing. Main thing is to keep control on us, yes, and we choose the activities, work, activity, compromise, how we keep our time, such a way we switch off us. We try to avoid for the society to put his rhythm on us, which is not his. It's for us to keep control in our life, since our time keeping, including our thoughts, our feelings, our activities, this kind of thing. But now psychologists call one thing which they call it mindfulness. So it's such a kind of life which allows us to live in harmony with ourselves. That's pass for keeping simple like this. Keep active, which of course is good, but control activity. Exercise is good kind of exercise. You know, all as we run through transport, all these things, but it's different of a good physical exercise in a park or gym, academia, how you tell it in Brazil. And choose, if when it's possible, or adapt our life to kind of work can switch for us, because work activity which is good for you may not be good for me. So this kind of mindfulness can help us to live kind of well-being, you know, allow us to beat stress. That's my advice.
And when we come back in the second block, we're going to be talking about hemorrhoids. Stay tuned. Hello everyone, we are back in the second block recording today with Dr. Monteiro from the Monteiro Clinic. The first block we spoke about stress, and now we're going to speak about hemorrhoids. I think this is a topic that many people sometimes avoid getting more information about it. And I'm sure that as you have experience here with your patients, you can see many people who has the wrong information about hemorrhoids. So clinically speaking, Dr. Monteiro, what are hemorrhoids?
Thank you again for coming for this important matter regarding public health. I will say public health because there is a large number of people suffering from hemorrhoid, mainly from 40 up. Of course, there is a lot of cases also, a few cases before 40 year age, but mainly from 40 that keep going up. But responding or answering your question, hemorrhoid is a swelling around the bottom area, which medically we call anal area or rectal area. Could be around or internal due to enlargement, so augmentation, enlargement or vessel, mainly the vein, because normally there is nothing to do with arteries, due to the enlargement of the vein. Hemorrhoid in some way, practically, changing from medical definition to practical facts of the daily living, is like varicose vein in a leg, which everyone can get, but mainly women more with the arthritis to the varicose vein, is the vein then enlarge, lost its capacity of contention, enlarge, but in an area so sensitive. That's why people note a few discomforts probably.
Okay, and why do people get hemorrhoids?
Two things. The real cause of hemorrhoid is not known very well. there is theories, but there is nothing to prove that exactly. But it's not more important also for treat people. Just as a method of information, I will say hemorrhoid may be to do with our position. So erectile position, standing position. As we see, people with varicose vein, if they stand long time, the varicose get worse. And probably our position as standing or sitting down long time, that can also make us more prone for hemorrhoids, one of the causes. Why people get hemorrhoids? That's important things. And because most of them are situation can be avoided. First of all, constipation. People constipate. In the constipation, some people is more usual to get it than other, but a lot of us now in modern society we got constipation because the way we eat, about nutrition, for avoid the increase in fibers in our meal. That's avoid the constipation. The constipation also reduce hemorrhoid. As I was planning, so constipation is one of the cause. Sedentary life, no activity, that's increase it. Pregnancy, unfortunately, increases. Poor activity, increase it also. And overweight also. That's just a few more common cases we can increase the case of situation of hemorrhoid.
Okay, so maybe there are viewers watching, listening to us, and they have some symptoms, but they don't know if that is caused because of hemorrhoids. So how does a person knows he has hemorrhoids?
Yes, and as you said, it's true. And the other reason also is I know it's a bit embarrassing situation. So people don't see doctor or medical or the GP immediately because they're suspicious of hemorrhoid. It's something they try to avoid or try even in certain stage not recognize. I'm not saying deny, but not recognize. Prefer nothing to do and still see doctor immediately. But the more early symptoms hemorrhoids strangely start by itchiness around the bottom, anal area, discomfort, pain, or patient in this case may need a swelling in the local, a mass, till the more advanced stage bleeding. When they open their bowel or go to toilet, may notice they bleeding. Oh. That's the main symptom of hemorrhoid.
And if the viewers are now recognizing these symptoms, and when does a person needs to seek medical advice?
In the fasting stage, if someone notices some discomfort, which is probably draw more attention of the patient, notice some discomfort in their bottom, in the anal area. But it's easy to go to the pharmacy over the counter, as we said. Over the counter, they can get cream, is local cream to use to see if they relieve their symptom. If they change diet, so using more fiber, more veg, more this whole grain, this kind of food. If all these measure, more fluid, liquid activities, if all these basic measure, if the hemorrhoid still persists, I see situations to see GP. Because what doctor will do is to assess the patient. It can be a bit discomfortable in certain way, but I think it's more important to see doctor. Doctor do an internal examination of the bottom area, and all of doctors work normally experience in diagnosing hemorrhoid. So we can find really sign very clear the hemorrhoid, which allow him to tell patient what you suffer from is this hemorrhoid, and treatment should be this in this stage. If you've been doing follow your diet, your lifestyle, all these measures normally come in the magazine, in the pharmacy, or whatever. Probably now it's time to start with the real treatment. Start with local cream, and then sometimes tablet anti-inflammatory. I will say a great number of patients respond to this treatment. So basic measure plus local cream is appropriate for the disease, and some tablets who act anti-inflammatory. But there is a few not respond even their treatment, so they may need surgical treatment. Mainly when it's a large, so big, I would say large hemorrhoid or bleeding hemorrhoid, sometimes they need surgical treatment.
Okay, so we got some tips here concerning what cause hemorrhoids, and also how to find the cure for it, right? Because many people as well, when they get to know, they find out they have this problem, sometimes they don't know how to cure. So if they go and seek medical advice, they also gonna find help for it, right? We have here a question from one of our viewers. He says like that: I find blood in my stools. Should I really talk to my doctor? I feel so embarrassed.
My answer is yes. Anytime a patient finds stool, when going to toilet or open his bowel or her bowel, it should for two reasons. It's helpful if I pass this information. Normally, when it's hemorrhoid, which is less dangerous than other situation I'm going to explain, the blood is live blood, really red blood. But we have to remember always that presence of blood in stool most of the time is thankfully related to hemorrhoid in a disease like this. But we have to make sure it's not caused by other more serious disease like cancer. So that's why my answer to this patient, yes, see GP. GP do internal examination, which is very short period examination, 5 minutes. It's not difficult examination. That's enough to diagnose at least 90% of serious cases which can be related to cancer, rectal cancer. If in that case, if the doctor don't find something, you will proceed referring patient for more advanced investigation to confirm the disease or not. But if no finding nothing, in the reassuring a patient that is not nothing to worry about, this hemorrhoid, follow this treatment, even despite all this thing, the blood keep coming in the stool. So it's better to return to see doctor, explain this situation, because they may did a kind of investigation more advanced using some device, medical device, to see the bowel more inside and more up to prevent case of bowel cancer. Don't forget, sometimes certain few symptoms of hemorrhoid can be caused by bowel cancer, and in that case, the earlier diagnosis, the more earlier the diagnosis is made, better is treatment. Okay. So my answer to this patient, yes.
Okay, that's good. So Dr. Monteiro, thank you so much for receiving us here today. Our viewers, I'm sure they are very happy with all the information. Very simple, very practical, right? And I believe that he took also all the fear concerning stress or hemorrhoids. People can see that there is a solution for it, right? So we are finishing here for today. We're gonna go back to our studio and see you next time. Bye-bye.